I want to tell you about a patient I will never forget. I will call her Dorothy. She was 71 years old when her son first brought her to my department. Sharp woman, retired school teacher. Her son told me she had spent 35 years teaching literature, that she could recite poetry from memory, that she ran her household finances on a spreadsheet she built herself. He described her as the person the whole family called when nobody else could find an answer. Then, over the course of about 14 months, something changed. She started losing words mid-sentence. She forgot appointments she had written down. She got confused driving home from her church, a building she had attended every Sunday for 30 years. Her primary care physician referred her to a neurologist. The neurologist suspected early Alzheimer's. Her son was devastated. But here's what nobody had done before he brought her to me. Nobody had looked at her medications. When I reviewed Dorothy's complete medication list, her prescriptions, her over-the-counter sleep aids, her reflux pill, her bladder medication, I saw it immediately. She was not developing Alzheimer's. Her medicine cabinet was dismantling her brain one chemical interaction at a time. We worked with her physician to systematically address the medications. Within 5 months, Dorothy was calling her son to read him poetry again. My name is Dr. Miles. I have spent 13 years in emergency medicine, and I have watched this happen more times than I can count. Drug-induced cognitive decline, presenting as dementia. Families told to prepare for the worst. And the cause, sitting in a pill organizer, on the kitchen counter. Today, I am going to walk you through the 9 most common medications quietly stealing memory and cognition, after 60 ranked from commonly overlooked to the most dangerous pattern in modern senior healthcare. And I need you to stay through to number 1, because number 1 is not a single medication. It is a hidden pattern affecting millions of seniors right now that almost nobody is talking about. Before we begin, I am not telling you to stop your medications. Please do not do that without speaking to your physician. What I am telling you is that you have the right to understand what is entering your body and the right to advocate for your brain. Knowledge is not dangerous. Silence is. Drop a comment right now. Are you over 60? List the medications you are currently taking. I read every single one, and your experience may help someone else watching today. Number 9, diphenhydramine. How many of you have a box of Benadryl or a PM pain reliever in your nightstand right now? It is over the counter. It says sleep aid on the label. It feels completely harmless. But diphenhydramine belongs to a drug class called anticholinergics, and that word is going to appear throughout this list. So remember it. Anticholinergics block a neurotransmitter called acetylcholine, the brain's primary messenger for forming memories, maintaining focus, and staying alert. When you are young, your brain has acetylcholine to spare. After 60, you are already running on a lower baseline. Block more of it nightly with diphenhydramine, and the impact on cognition becomes significant. Research published in the Journal of the American Geriatric Society found that regular users face substantially elevated risk of cognitive decline, with measurable shrinkage in memory-related brain regions. And it hides in anything labeled PM, nighttime relief, or sleep formula. Ask your doctor about second-generation antihistamines, like loratadine or cetirizine, for allergies. These do not cross the blood-brain barrier the same way. Number 8, proton pump inhibitors. If you have been taking an acid reflux pill every morning for years without anyone suggesting you try stopping, this entry is for you. PPIs are among the most overprescribed medications in the world. Most were designed for 8 to 12 weeks of use. Millions of seniors take them indefinitely. The problem is that stomach acid is also essential for absorbing vitamin B12, and B12 deficiency is clinically linked to memory impairment and a pattern of cognitive decline so closely resembling Alzheimer's that the two are sometimes confused, even by experienced physicians. A study in JAMA Neurology, examining over 73,000 adults, found that long-term PPI users had a 44% higher risk of developing dementia. If you have genuine medical need for a PPI, have your B12 and magnesium levels tested regularly. If you do not, ask your doctor about tapering off with dietary adjustments as support. Number 7, bladder control medications. Overactive bladder is real. It is disruptive. And when a doctor prescribes oxybutynin, you take it because you trust them. What almost nobody explains is that oxybutynin is one of the strongest anticholinergic medications in common clinical use. It does not stay in your bladder. It crosses the blood-brain barrier and directly interferes with the acetylcholine systems responsible for memory and learning. Studies have shown the hippocampus, your brain's memory center, demonstrates measurable volume reduction in long-term anticholinergic users. A 2019 study in the British Medical Journal found that seniors using strong anticholinergic medications like oxybutynin for more than 1 year had a 49% higher risk of dementia diagnosis. Ask your urologist about mirabegron. It works through an entirely different mechanism and carries dramatically less cognitive risk. Number 6, benzodiazepines. Valium, Xanax, Ativan, Klonopin. These medications have helped millions manage severe anxiety and sleep disorders, and I am not dismissing that. But hear the science. A study tracking over 8,000 seniors across 6 years found that those who used benzodiazepines for more than 3 months had a 51% increased risk of Alzheimer's disease. When GABA, your brain's calm-down signal, is chronically overamplified, neuroplasticity deteriorates, memory encoding slows. The brain that was being calmed begins losing its capacity for dynamic response. Never stop benzodiazepines abruptly. Work with your physician on a slow, supervised taper. Alternatives include buspirone for anxiety and cognitive behavioral therapy for insomnia. Number 5, certain statins. Statins save lives. For many patients, they are appropriate and essential. But your brain is made of nearly 60% fat, and cholesterol is a structural necessity for the myelin sheath insulating your nerve fibers and for synapse formation. The FDA updated statin labeling in 2012 to include warnings about memory loss and confusion after reviewing thousands of adverse event reports. The critical nuanced lipophilic statins like simvastatin and atorvastatin cross the blood-brain barrier more readily than hydrophilic statins like pravastatin and rosuvastatin, which show significantly less cognitive impact in comparative studies. If you are experiencing brain fog on a statin, ask your doctor about switching. Also, have your CoQ10 levels checked. Statins deplete this compound critical for cellular energy in the brain. Number 4, amitriptyline. This one surprises people every time because amitriptyline is frequently prescribed for nerve pain, migraine prevention, and insomnia, not depression. Doctors use its sedating side effect as a feature. But amitriptyline is one of the most potent anticholinergic medications still in widespread use. A landmark study in JAMA Internal Medicine, examining over 3,400 adults aged 65 and older over 10 years, found that high cumulative anticholinergic exposure with amitriptyline among the top contributors was associated with a 54% greater risk of dementia. Even low steady doses over years created significant cumulative burden. The damage rarely announces itself dramatically. There is just a slow, creeping erosion, word-finding difficulties, problems with sequencing that gets attributed to normal aging for years before anyone questions the medication. Number 3, antipsychotics. What I am about to say happens every single day in care facilities across this country, and most families never find out. Antipsychotic medications were developed for serious psychiatric conditions. They are being routinely prescribed off-label to elderly patients who are simply confused, restless, or difficult to manage, not because they have psychosis, but because they are inconvenient. The FDA issued a black box warning about this practice, citing increased risk of death in elderly patients. A 2022 study in The Lancet found that seniors given antipsychotics for behavioral symptoms were 71% more likely to experience worsening cognitive decline within 12 months. If a loved one in a care facility is prescribed quetiapine or risperidone without a documented psychosis diagnosis, ask why. You are entitled to that answer. Number 2, paroxetine. Paroxetine, sold as Paxil, is classified as an SSRI, the same family as Zoloft and Lexapro. And when people hear about SSRI, they think modern, safer antidepressant. Paroxetine is the exception. Unlike every other SSRI, it carries significant anticholinergic activity. A 2021 review found that elderly patients on paroxetine showed measurable declines in short-term memory and verbal recall within the first-year declines not observed in patients on other SSRIs at comparable doses. The American Geriatric Society has placed paroxetine on their official list of medications considered potentially inappropriate for older adults. If you are on Paxil and over 60, Ask your physician whether switching to sertraline or escitalopram might offer equivalent benefit without the cognitive burden. Number 1. Anticholinergic polypharmacy. I told you number 1 was not a single medication. Here is why that matters more than anything else on this list. Every medication above, taken alone, might cause only mild cognitive effects in some people. Easy to dismiss. Easy to attribute to aging. But the average American over 65 takes 4 or more prescription medications daily, often prescribed by multiple doctors who do not have full visibility into each other's prescriptions. When several carry anticholinergic properties, research suggests they do not simply add to each other's effect, they multiply it. An analysis tracking over 280,000 older adults found that those with the highest anticholinergic burden had a 120% increased risk of developing dementia over 10 years. Double the normal risk. From pills their doctors told them were safe? Here is what this looks like. A 70-year-old woman takes Benadryl PM every night for sleep, oxybutynin for her bladder, amitriptyline for foot pain, and an over-the-counter heartburn pill every morning. 3 of those 4 are anticholinergic. Each prescriber independently considered it appropriate. Nobody calculated the combined burden. This is not a hypothetical. This is Dorothy. This is Margaret. This is your mother, your neighbor, your spouse. And this is happening right now in millions of homes. Here is your practical plan. Write down every single thing you take. Prescriptions, over-the-counter products, supplements, everything. Look up each one on the Anticholinergic Cognitive Burden Scale, a free, publicly available tool. Schedule a medication review with your primary care physician using those exact words. Ask specifically about deprescribing the supervised process of tapering medications that carry unacceptable risk. And if your doctor is dismissive, get a second opinion. You are not being difficult. You are being responsible. Drug-induced cognitive decline is often reversible. I have seen it personally. When the medication burden is identified and reduced under proper supervision, many patients experience a remarkable recovery of mental clarity. The fog lifts. The person comes back. Your brain is adaptive, resilient, and capable of healing when given the conditions to do so. The person who most needs to see this video is probably not going to search for it on their own. You might be the reason they find it. Share this with someone you love today. And if this gave you clarity, subscribe to this channel right now. Every video I release is built on 13 years of emergency medicine experience, designed to give you the real picture before a crisis forces the conversation. Hit subscribe. Tell me in the comments which of these 9 medications you or someone you love is currently taking. I read every single response. Thanks for watching. I will see you in the next video.